Hey guys, welcome to another episode of the Optimal Health Podcast. I'm your host, Ollie Matthews from OJ Health, and today we've got something different to your typical testosterone focus, but I think is actually pretty much as important, if not more important, to talk about this topic. We've got Jeff Nuziard here from the founder of the Sexual Wellness Centers of America and an innovator with his treatment where he has RegenMax, which is the only patented protocol proven to cure and prevent erectile and vaginal dysfunction. I need to get my words right. More than 3,000 patients have completed the program with outcomes consistently reflecting the really high 97.2% success rate, which was first demonstrated in the clinical trial. Jeff, thank you so much for joining us.
Thank you for having me. I'm very happy.
You're over in the US, right?
I am bright and early this morning.
Cool. And I think it's important. I like to have people's bios and read through them, but tell us, who are you? Tell us a little bit about your story.
You know, I'm just a guy that went through a major issue at 40 years old. Woke up and I always say woke up. It didn't happen overnight like that, where just one day it just quit working. It was a degenerative process, but it felt like it was like overnight, very sexual in my mind, but my body was not cooperating and I could not get an erection. It started out with I couldn't maintain it, and then I just couldn't get it.
And how old were you at this point?
I am 60 years old, going to be 61 in October.
But when you couldn't get the erections?
I was 40
Exactly.
years old, yeah. Sold everything I had and literally over time spent a whole lot of money and a lot of years of research and development. And I will tell you that when things started working, I was like, I think I'm onto something here. And ended up getting awarded a PhD for my work in biomedical science. It's been a very long, arduous process. But the good news is we're over 3,200 patients have gone through the program, and we've maintained that 97% success rate.
That's amazing. That's amazing. You say you thought you were onto something. What made you feel, considering the standard Western approach, which maybe they give medication for erectile dysfunction or something like that, or say someone's depressed, like what made you think you were onto something?
Well, because what you said is right. Everybody has the same tool bag. It's Cialis, Viagra. People have tried PR, people have tried shockwave, and it just wasn't working. And I'm not a guy that likes drugs, any kind of pharmaceuticals at all. I believe Western medicine does a lot of prescribing, and prescriptions have really never cured anything. They basically treat symptoms, and that's what I was not about to do. I just figured, I understand our bodies are designed to regenerate and to heal themselves, but you gotta trigger the right things, eat the right things, do the right things. It's people get really blown away at the 97% success rate, and I will tell you, I was blown away with it too. But it's real simple. It's actually so simple that people have tripped over it and walked right across it, not seeing it. And I'll just answer by asking you a question. Have you ever cut yourself before?
Absolutely.
And what was the percentage of likelihood that cut was going to heal?
It's pretty certain.
Right, exactly, right. Well, all we're doing is creating the intentional damage in the penile tissue that is going to correct itself and heal itself. And I liken it to lifting weights. When you lift weights, you tear your muscle, do you not?
Absolutely. Yep.
Okay, and then your body does what? It regenerates new muscular tissue to mend the tear. It's not that it glues the tear back together, but it generates new muscular tissue to regenerate the muscle and make it bigger, better, stronger. That's exactly what we're doing. We're creating micro tears, creating damage in the tissue, and then we're helping it along the way with some biologics that were invented as well that make this happen very quickly and much quicker than PRP ever thought of being. PRP is not a bad thing, but it's all we knew. It's been around for 35 years, I guess now. And it's all we knew at the time. But I will tell
Just
you,
tell us a bit about PRP for those that
PRP,
don't know.
I'm 60 years old. What my exosomes and my PRP aren't very good. They're old. They're not regenerative. So why am I going to take 60-year-old exosomes from me and put it back into my body hoping to regenerate new tissue? It doesn't work that way. So that's the downside of PRP. It works for younger people. But if you don't create the damage and you don't create the tears in the tissue, and that sounds so bad, barbaric, that there's no downtime. There's no downtime. You don't even realize the damage has been done. Just like when you lift weights, you don't realize that you've torn your muscles apart, but you have. And so there's no downtime or no pain in RegenMax, just results.
Okay, and I wanted to go into a bit more about erectile dysfunction and everything like this, but this seems the perfect time to actually say, what actually is RegenMax?
What is RegenMax?
Yeah. Like,
RegenMax,
what is your process?
RegenMax is a four-step, four-pillared, I call it, four-pillared protocol that treats the entire erectile situation. And I say that because for centuries, erectile dysfunction has been written off as a blood flow problem or lack of blood flow problem or blood circulation problem. Everybody wants to do nitric oxide, and we do Cialis and Viagra to dilate the vascularity to get more blood in. And it still hasn't fixed the problem. And that's where my head was like, hey, everybody's putting more blood in, but it still doesn't fix the problem. Why is ED growing, no pun intended, but becoming a bigger issue? And maybe it's not blood flow. And so that's kind of where I went into it. And every white paper that I would read regarding somebody else's research on erectile dysfunction, everyone, without exception, was dancing around the issue, but not addressing the issue. For some reason, it was overseen. And I kept saying there's a common denominator in all these papers and all this study material, but no one's addressing that. Let me address that. And that is this. We have inside of our penis the corpus cavernosum, two tubes, and what's called the spongiosum that are responsible for absorbing that blood flow that comes in. And then when it gets full enough, it activates a muscle behind the scrotum called the bulbospongiosus.
Okay.
And that muscle is designed to lock down and keep the blood in until orgasm. And then that muscle relaxes and the blood flows back out. If it's not full enough, that muscle doesn't get activated entirely. It gets weaker and weaker over time to where it develops atrophy. And so the first symptom of erectile dysfunction doesn't mean you have erectile dysfunction, but it means it's coming on, is called the venous leak. I can get erect, but I can't maintain the erection. Mm-hmm. And it's because that muscle's not locked down all the way. So we have to figure out how to get the atrophy out of that muscle, number one. Number two, why did that muscle not get activated? Because the sponge wasn't absorbing everything. And to prove that point, every patient that comes in our office, they say, I've been on Cialis for 5 years and it's been working great. The last 6 months, it's not working now. Why is that? Well, those pills work. They don't fix the problem, but they work. They dilate vascularity, and we don't get resistant to those pills. They work. But the problem is if there's nothing to absorb that blood, it's just blood in, blood out. Okay. And every person I say, well, do you have any change when you take Cialis now? I know you can't get an erection, but anything happen? Oh yeah, it gets a little firmer. Yeah, but that's because there's blood going in. It's just not being held in there. So I kept seeing this over and over. And so that's where it took me back to. And I said, we got to fix the absorption problem. The sponge, the tissue is weak. So let's fix that. Let's get the atrophy out of the bulbospongiosus muscle. And then we have to create angiogenesis, which is where your body creates new blood vessels. So we have to create that to get new healthy blood flow back in. So blood flow is a result of erectile dysfunction, not the initial cause. So we fix the initial cause, then we repair the blood flow, get the atrophy out of the muscle, and we're back in business.
And are you doing this with injections and things like shockwave therapy as well?
Again, it's a 4-pillar protocol. So before I go into those, let me back up and explain that the aging process has been misdiagnosed for centuries as well. By that, what I'm saying is people have been told that we age and lose hormones as we age. That's not actual fact. The truth is, somewhere in our 20s, we stop producing testosterone by about 2% a year. Happens to men and women, same time. And it's different for everybody. It could be 20, it could be 29, it could be 30. It's not an exact thing. It's, I will tell you this, the older patients I have, their natural testosterone level is higher than this younger generation because they stayed busy, they stayed working, physical labor, they weren't sitting in front of a computer all the time, didn't have a phone sitting on their butt watching reels and TikToks and whatever. They were busy working, keeping their bodies moving. That keeps your body producing hormones. But we start to stop producing testosterone. And when that level comes down, that's actually what starts and activates the aging process. So we don't start aging until that testosterone level comes down. So it all started when we hit a certain level of our testosterone, didn't realize it because it happens so slow, we don't feel it, we don't realize it.
Do you actually, if you look back at like teenagers and children going into puberty with more obesity, you see more erectile dysfunction at younger ages, like we're seeing lower testosterone at younger ages? Like, what is their testosterone before it starts dropping as well?
Absolutely. And I will tell you, I started this 21 years ago, and we've had a clinic, a retail clinic. We had a research clinic before that, right? Where we weren't charging, we were just figuring it out. But a retail Ford pay clinic for 6 years, almost 7. And I will tell you, in that 6 years, the age of patient has dropped drastically. When I first started, my patient base was 60 to 75. Mm-hmm. Now I've got guys in 30 years old. I had a college athlete, a big school college athlete, football player, come in at 24 years old, all the symptoms of low testosterone, tested him, 400 testosterone level. And this is an athlete. So yes, it's becoming a very bad epidemic. I don't know if you saw just yesterday, Secretary of War Pete Hegseth, United States military, just started that testosterone, that hormone replacement will now be required in the military. You'll be required to test your testosterone level. It's becoming such an epidemic because you got these 20, 30-year-old guys with low testosterone. And it's frustrating because all the medical books say, oh, it's normal. But normal for what? Like, what's normal mean anyway? What's normal for you is probably not normal for me. Every human body is different. The question is, what's optimal? And so what's the optimal testosterone level for you? But that's what starts the problem. And the first part of aging is our production of collagen slows drastically down. So the cause of erectile dysfunction is the lack of collagen in the corpus cavernosum and the spongiosum. And so that from there, it develops atrophy in the smooth muscle cells, then it develops atrophy in the veins, develops atrophy in the bulbospongiosis, and it's just a downhill spiral. Starts with, I can get erect but not maintain it, to I can't even get an erection.
Yes. I do get worried actually seeing guys that, I'm not a doctor, I work alongside some doctors as well, and I see a lot of blood tests that how low testosterone has become recently.
Listen, man, it's a bad epidemic. Actually, this is a political topic, and I don't mean it. I don't want it to be political because it's a medical problem. And I really believe that this whole gender identity crisis thing going on, and people not knowing what the hell they are, could be traced to a hormonal problem.
Well, yeah, absolutely.
I'm seeing it like crazy. I'm seeing guys in here with 300 testosterone levels at 25 years old. 300. I mean, a healthy woman is 150 to 220.
Yeah, and for those here in the UK, that's just under 14, like nanomoles a liter here in the UK. Oh no, that's 400 is 14.
Oh my goodness.
Yeah,
it's such an epidemic, And it's fixable. It's fixable. And that's what's scary about it. We're watching humanity get more and more, well, men mainly get more and more feminine and losing their estrogen dominant, and losing that fight and that drive to let's build, let's do, let's go, let's make it happen. They have no drive because they have no testosterone, and it's becoming a bad problem.
Do you feel hitting the testosterone first is going through the
I
pillars?
do it. I do it simultaneously because the damage has been done, right? I mean, we have the damage done. So, has begun, I should say. It's not completely damaged because maybe you can get an erection but not maintain it. Well, that the damage has started bad, right? When that happens, it's time to get treatments and get fixed. So hormone replacement is part of it. That's one of the pillars. And then there's only 2 devices in the entire world that will do this. One's a laser and one is a radio frequency device. But there's only 2 kinds, 2 different ones, and they have to be specific, that will put the right amount of heat in at the right amount of time, at the proper rate of speed, to where you're not burning yourself, not burning the tissue, not doing it, but you're putting enough heat in to remodel the collagen. And so that's the second pillar. And then we do utilize shockwave because that is what will break apart the atrophy. That's what will create the micro tears in the tissue, and it will create angiogenesis for the veins as well. So that's the third pillar. And then the fourth pillar is the biologics that I invented in this process that is 800 more times regenerative than PRP. Actually, I have a couple pulmonologists testing it right now in a nebulizer for COPD patients. And it's recreating new lung tissue. Our bodies are designed to regenerate. We just have to do the right things. So it's not that I really reinvented the wheel here or some kind of rocket science. I just picked up what people were skipping over, connected the dots, and here's what I found out. Ollie, when I do all 4 steps of this, I have a 97% success rate. If I take one of those away, I have a 40-50% success rate.
Wow.
So that's why it took so long to develop. I mean, I kind of got on to where I think the problem is pretty quick, but I wasn't clear on how to fix it. And then when it was just so much trial and error, and it was very discouraging because I kept, 2 steps forward, 10 steps backwards. I'm like, but I was able to see progress, and I'm like, okay, maybe I'm on something. And then I was like, but wait a minute, I'm not doing this. So then I'd add that to it. I'm getting better progress. So that's a telling issue. If I take one of the pillars away, I'm a 40-50% success rate. And I will also tell you, just hormone replacement does not fix erectile dysfunction. It doesn't. It will fix the drive. It will help your mind fog. It'll make you feel like $1 million, but it's not gonna fix the damage, right? So, I mean, I'm giving you 20 years of stuff condensed in minutes here, but that's kind of the process that I went through.
It's powerful as well because I deal mainly with guys either using TRT with a clinic, whether they're self-medicating or before TRT, like testosterone therapy. And the amount of times guys come to me and they say, I started taking testosterone, but I still can't get an erection. I still can't get a good quality erection. I said, because that wasn't the problem in the first place.
That's right.
And we need to work on the underlying root causes, right? And you've got a method here which is proven to work. Is it available outside the US yet?
Yeah, we are licensing. It's a global patent, and we're licensing this technology to physicians around the world now. Getting the word out. I'm just a small guy here, man. I would love to have a money guy come along beside me and walk with me in this and help me blow this up worldwide. Because look, in the US alone, Ollie, 30 million men admit to having erectile dysfunction. How many don't admit it? We believe that problem is more like 60 to 70 million.
Exactly.
uh,
Yeah.
that have erectile dysfunction, but they won't talk about it. And as a man, when you go to a party or a social event or something like that, and you meet people for the first time with men, that one of the first things that comes up is, so what do you do for a living? Right. And people ask me, well, what do you do for a living? And I'm like, oh boy, here we go. I fix broke penises. But it's funny how many men will say, well, I don't have that problem, but
Yeah.
my friend does.
Yeah.
Yeah. Okay. Sure.
Exactly. Exactly. With these guys as well, after they've had the treatment, are they able to completely stop like Tadalol or Cialis and
Yes.
Viagra and things like that? Yeah.
Absolutely. Yes,
Amazing.
absolutely. Yeah. I take no pills. I don't inject trimix or quad mix or anything like that. Um, I my wife and I have an amazing sex life, and I mean,
Amazing.
everything's good.
That's good. And how long does treatment usually last?
Well, we treat over an entire 6 months, and then able to extend for another 6 months. So it can be up to a year. And I say that because there are people. The reason I don't have 100% success rate, just like you had 100% likelihood your cut would heal,
Yeah.
there are health issues that don't allow your body to heal. Okay, uncontrolled diabetes is one. Your body just doesn't heal very, very well. And so for those, and then this is why wound healing, wound care is such a big thing right now, because there are some people out there just their bodies don't heal. Um, but but over time, I'm seeing 4 to 6 treatments, and all of a sudden they're like, "Hey, man, I'm waking up with morning erections again." Still not maintaining it there, but I'm waking up. That's the first sign we're back. We're coming back. You know, most of the time, my patients are done in 6 months. But if there's issues, prostate cancer patients that had a prostatectomy or radiation, those take longer because there's more damage. So we have to do more treatments. So in that case, we'll extend another 6 months. But I've never really had anybody not get some kind of results after a year. And again, it doesn't take that long to get the results. We're talking weeks here, to start getting results. But it's like going to the gym. Again, there's so much. I keep going back to going to the gym. When you see your body start to change, that's not the time to quit. You
Absolutely.
want to keep going and finish what we've started. And when our patients do that, we don't see them again except for hormones. That's it.
This is amazing. It's super powerful, and I want people to understand that if they've tried everything, they probably need to go down this route and see you guys. But also with erectile dysfunction, I always say the canary in the coal mine, and for other things going on. If people have erectile dysfunction, what other signs is that like saying about their health?
Yeah. What what I've seen, there could be other health issues, of course. Again, diabetes is a problem. In America, it's a bad problem because we got sugar in everything, and it's horrible. I wish to God we could figure out a way to completely ban it, but because
Yeah.
sugar is killing more people than anything. And by the way, sugar is the number one destroyer of collagen. People say health or sun is or smoking is. Sugar is the number one destroyer of collagen, and people are ingesting sugar almost by the pound daily, and it's horrible for your body. Um, so yeah, there's other health issues, but again, there are people completely healthy. I was one. I was a competitive athlete in college. After college, this is how I know. For me, when I was 27 years old, I was a competitive martial artist for many, many years. And at 27, I was in a tournament, full contact tournament, and they were testing us for testosterone levels. And basically, what they were looking for were, the 2000 and higher testosterone levels of people raging. You don't need ragers in a martial arts tournament. So um, the guy said, wow, your testosterone's 1185. That's great. And I said, I'm not doing anything bad. He goes, no, we're not looking for that. That's a great level. I said, what is supposed to be? He told me then, he said, a man your age should be anywhere between 900 and 1200. And I find in all my research that to be true. And that's an accurate statement. But like you just said a minute ago, you're seeing 14-year-olds at 400. It's a problem. It's a bad problem. And when that testosterone drops, the damage begins to take place in the penile tissue. It happens with women in the clitoris and in the vaginal canal. And they wonder why women say, why am I so dry? It hurts so bad. It tears. I have no sensation, no orgasms because I have no sensation in the clitoris. That is a woman's version of ED. There's the difference between a penis and a clitoris. One's bigger, one's smaller. One has a urethra and one doesn't. That's it. If you do a cross section of a clitoris and compare it to a penis, they're identical.
It's something I feel, and with those numbers as well, as in the testosterone conversion, it was guys in their teenagers, basically like 400 is 13.9 nanomoles a liter over here in the UK. So we have just different totals. So it wasn't a 14-year-old, it was a guy who was in his late teens. But it's still, they should be much higher than that. And it's happening far too often as well, right? Guy comes to you, say they're in their 40s and they've got erectile dysfunction. What investigations do you start doing?
When they first come to see me, most of the time, it's pretty obvious they're self-diagnosed. They come in and I just say, tell me what's going on. Because what they'll do is they'll call and say, we're having issues. Okay. Well, they come in and tell me the issues. I can't get it up. Explain that. What do you mean? Can you get erected but not keep it? Can you get a half an erect? I mean, explain, give me details. So they break it down. And most of them, I would say 75, 80% of the men will say, every once in a while, I get a really good erection. But I'm always worried it's going to go down too soon, number one. Number two, if it's not good enough, a hard enough erection, it's just not as fun. So the quality of the erection drops drastically. And there again, that's because you don't have enough sponge to absorb and to hold that blood in there. So you get a 75, 80%er and you're like, okay. It doesn't work as well. So then we go through that. We go through their health question, their health questionnaire and say, tell me diabetes, what kind of medical conditions, what kind of pharmaceuticals are you on? In America, embarrassed to say it, but we're a pharmaceutical addicted country, man. It's horrible. The amount of pills and stuff that people take. And I blame medicine on Western medicine on that because, you give a prescription for for diabetes, and then you give it for blood pressure, and then another prescription for pain and this and that. Or I'm not focused. So we give them Wellbutrin or some kind of SSRI or something. And next thing you know, you're taking 6, 8, 20 pills, whatever. And some of those are counteracting the others, and your body doesn't know what's going on because each pill is designed to treat a symptom. It's not designed to fix the problem.
Yeah.
So a lot of prescriptions can cause ED.
What sort of, that was actually going to be, you took the words out of my mouth. It was going to be what medications can contribute to ED. So
well, just being on a cocktail of pharmaceuticals can do that. So you got to break it down. Let's go through each one. What are we doing? What are we on? I'm not a medical doctor and I don't claim to be a medical doctor. I'm a scientist, but I work with a couple MDs, and if I don't understand understand the pharmaceutical, I'm on the phone and I'm like, talk to me about, there's a new one, Essex, I think it's called. It's an SSRI, which is for depression or anxiety, things like that. But it's a very low risk factor SSRI drug for ED or sexual drive. So, you got to understand all those things, and understanding that if you take a cocktail of them, that can be a problem. Doesn't mean we can't fix We will physiologically fix the problem. We will get the tissue and the blood flow restored. Whether you're destroying it again because of all the drugs you're on, or because you refuse to get off your butt and go walk 10,000 steps a day, or you want to sit behind a computer all day long and do nothing and be completely sedentary and lethargic, well, that's your call. And by doing all that stuff and eating horrible, you can degenerate right back. What I will tell you is I have patients that we treated 10, 15 years ago in research that are still doing great today. I've got patients in their 80s having sex 4 days a week that weren't having sex at all.
That says everything, really.
You fix the problem, and then it's up to the individual. And you don't have to be a gym rat or some kind of a, health food guru, whatever. Just a general good care of yourself. The biggest thing is, Ollie, stay moving. Keep your body moving. If you just do that, your body, red blood cells bring life. Known fact. So let's just keep blood moving constantly in our body and keep our body healing itself and bringing new life into our tissue by keeping the blood flow, keeping moving.
Do you separate the psychological and physiological, say it was physical ED rather than psychological or relationship factors causing the ED? Or
yes, we do. And I'm so glad you brought that up. Great question. We tell patients when they come in, we can fix the physical problem. If you've got an emotional problem or relational problem, we have people to refer you to, because that's not what we do. And I will tell you, I get a lot of patients that say, you know what? I'm waking up with erections. I can masturbate, no problem, but I can't have sex with my wife. So I don't think it's working. Okay. What did you just tell me again? You can masturbate, have no problem with an erection there. You're waking up with good erections in the morning, but you can't have sex with your wife. So what's the common denominator there? And a lot of times it's just a mental psychological block.
Yeah. I've found as well that, and this is more coming from the low hormones causing side of things, when the psychological aspect is being caused as more of performance anxiety.
Absolutely.
So when they fix the testosterone, it can help as well. But I'm interested to dive into common, conventional treatments when we look at why they fail. So Viagra and Cialis, for example, what do they actually do, and why do they actually work for some guys and not others?
Again, they work. Whether they can maintain it, whether you can get an erection or not, different point. A lot of physicians will prescribe Cialis for high stressful jobs. Their blood pressure rising up, they're having a really bad stressful day, their blood pressure's climbing. Take this 20 milligrams of Cialis, boom, within minutes, brings the blood pressure back down, because they work. The vasal systems dilate, right? Blood flows. The reason why they work and then they don't work for erectile dysfunction is the sponge is bad. The blood is not staying where it's supposed to stay. That's what drove me in to research this, because you were getting the blood in, but it's not working anymore. Now we're getting the blood in. What's the problem? We're not absorbing the blood. It's going right back out again.
And going on to other things like maybe less known about, but is a penile Doppler useful at all at any point?
Say that again.
Is a Doppler useful at all?
Yeah, sometimes. Yeah. Sometimes if we got not getting the benchmarks, if we're not moving in the right direction we want to move into, we'll do the Doppler to see if they got any kind of blockage going on. But most of the time, the shockwave will clear all that out.
It's interesting, because I've got a guy that's had issues for 12, 13 years. And okay, he's here in the UK, so it's going to be harder with treatment wise. So it's finding, when you've eventually got it in the UK, it's right, you need to speak to these guys. But he's had maybe not the same machines, but similar treatments of different things. So maybe like 3 of the 4 pillars, but he's then seen resolution and then gone down, seen resolution and then gone down, because each one has been done individually as well.
Yeah. Every one of those things, Ollie, they're not bad. People who do just shockwave, that's not a bad thing. It's just not going to, you got a 40% chance to fix it with that because nothing has been addressing the sponge.
How do we get this into the mainstream?
By guys like you inviting me on to talk. I do a lot of speaking at conferences and things like that. And it's funny to me, traditional medicine doctors want to argue with me because if it's new, it must be snake oil or not work or whatever. Just because they haven't heard about it doesn't make it bad or wrong. And my question is, with all due respect, what research have you done besides medical school and what they told you? Yeah. Because that's what medical school is. What people tell you, that's how you form your opinion and your process of care. So what about science moves? Here's a great example. My grandfather passed away in 1980 because he had prostate cancer. Well, if you get prostate cancer today, I mean, it's not a big deal. We treat it, it's fine. Because the science has advanced so much in that 40 years, 45 years now, that prostate cancer is not a life-threatening issue anymore. So if you don't keep up with science and how science changes, there's guys like me out there right now working on different things and cracking codes and coming up with cures for issues, and you got to keep up with the science and don't be afraid of it. And don't, you listen, I get the skepticism. I was skeptical of myself for a long time until I saw so many results. And then I'm like, hey, like I said, I'm onto something. I thought, maybe it's just working for me because I wanted it to so bad. But, and the other question is, well, how come I'm the only guy that's come up with this? Well, how come no one else, all these doctors in the world, no one's come up with this process? I don't know that answer to that question. And so I get the skepticism. And the reality is it's working and it works very well. So you can't be afraid of science. And that's the problem. We're treating an old issue an old way. And I want to get this research out and get this out in the mainstream. Money solves a lot of problems, and I've spent
an investor for you.
$4 million out of my pocket.
Wow.
On developing this. And I don't have any, I just don't have the money. I'm living fine. I mean, I'm okay, but I don't have the money to blow this up, which is why we're licensing it to around the world now, because we want when we license it, you got to come to our office for training. And it's an in-depth training. And we go through all the science and doing procedures and things like that. And the more I can speak about it and the more we can talk about it, the better it's going to get. And the more people are going to know about it. When I started this, sexual wellness was not discussed. Erectile dysfunction, nobody liked to talk about it. It was a taboo thing. Now, thanks to TikTok and Instagram and all that, there's so many ED things out there. It's a very common thing. And unfortunately, all these young guys are requiring some kind of help now. And so it's a common thing to talk about. So it's very easy for me to talk about it now, and it's more acceptable.
On that note, do you feel there's a certain age that guys should start focusing on their sexual health?
Yeah, I do. First of all, in a perfect world, we would start testing hormones in their 20s for no other reason. I mean, I wish it would be a requirement. It's not. It's still taboo, but for no other reason. If I had not had that martial arts tournament where they tested me, I would have never known that at one point in my life, I was 1185 level. I would have not known. But you know what? When I was 40, my level had dropped to 305. So it went from 1185, 13 years later, boom, down to 305. I mean, that was embarrassing. You know, I didn't do it intentionally. Some of it was genetic. Some of it was what I was maybe eating. I don't know, but I know that's what it was. Those are the facts. And so I worked on that first. And then the more I started studying and researching hormone replacement, the more I started realizing, boy, there's a lot of people that don't know what they're doing. Because you ask 10 people about HRT and you get 10 different answers. And, you know, in our clinic, I've so many years of studying hormone replacement that I don't allow our patients now. I have nurse practitioners and doctors that treat the patients, but and it's a rule and a protocol in our clinic. Nobody, once we get your testosterone back up, we don't let anybody drop below 700 ever again.
Yes.
Ever.
I think we need more awareness, and I feel when I've spoken to more Western doctors, some are supportive. Don't get me wrong; it's not everyone. It's not a blanket statement.
It's getting
everyone,
better. You're right.
But we need more people to realize that we're trying to work together. We're trying to get people healthy, right? And on the other note as well, how important is fat loss in order to help with erections?
Fat loss is a big deal. Of the 3%, 2.8%, whatever that we're not getting success on, we're still getting some results, you know, but it's just not what we consider successful, which would be a full erection, penetrable until orgasm. And, you know, then all of a sudden they had no erection. Now they're getting 50% or whatever. That's not success to us. But of those guys that are not doing that, 90% of them are obese.
What about if someone has used GLPs to lose fat? Is that going to be a positive or negative? How quick it is?
You know, right now the jury's still out on that, right? I'm studying that really hard right now, and I'm looking at it because there's a lot of people claiming this, you know, this degeneration of muscular tissue with GLP-1. I have some NFL guys that are patients, that retired NFL guys, that after the game, after they retired, they put on a lot of weight, and they also understand how to work out. And when they come in, I say, listen, let's do the tirzepatide, but it's imperative you keep working out.
Yeah.
Those guys that are lifting and working out and not just going to a gym and saying they're working out, but they're actually working out, they look amazing and have lost a lot of fat content and not lost any muscle tissue. You know, so yeah, if you're looking for a quick fix without working your body out, you're going to lose muscle tissue. So I guess right now I am a cautious fan of the GLP-1s, in moderation, and with using working out as a partner in that. But it comes back down to, if you don't change your eating habits and if you don't stay physically active.
Yep. It's a supportive medication, but it's not the shortcut people think it is. I truly believe when we say, if we use it without training, without a good nutritional base, movement as well. Same with testosterone therapy, right? If you think that you're overweight, you take testosterone, you're going to aromatize a lot more if you're highly stressed, eating crap, drinking loads of alcohol, not training. It's not going to be the panacea people think it is.
That's right.
And we need to work and take responsibility of that. So last thing on here, that say a guy in his 40s, a dad is listening, erections are less reliable, energy is dropping, waist is growing. He feels embarrassed, he's ignored it. What would you say to this guy?
If they're in America, I would say go on our website and we'll find you a physician immediately and get you treated, because the longer you wait, the longer it's going to take to get fixed, and you're going to have more and more issues. And by the way, when those issues, the more you have those issues, the more mental blocks you get. You get into that moment about to have sex and immediately, oh my God, what if? Oh no, and you panic, and now you're out. You're done. It's not going to work because your mind has taken over. So the earlier you get treated, the better. Doesn't mean we can't fix it later on. We can. The earlier, better. If you're in the UK, by all means, talk to your doctor. Have them call me. I want to get this out there worldwide. Right now, we don't have anybody in the UK right now. Nobody. And I would absolutely do flips if I could get somebody in the UK.
What do you need that doctor to have to reach out to you? Do they need to have their clinic? And yeah, I'm interested. There's a couple of doctors I know of and I work linked closely with.
If we prefer, I would never want somebody to go through what I went through starting my clinic. I thought, because I was all excited about it, everybody's going to line up at the door wanting their erectile dysfunction fixed. That's all we do in our office. And it's been a lot of hell getting to where we're stable and making money, because a lot of people are still in denial over it. And a lot of people don't want to spend the money to get it fixed. It's a great business model if you already have a patient base.
Okay.
And so if you're a functional medicine, a regenerative medicine, a family practice, I want you to call me and let's get going, because you've got a patient base and you'll make money without spending money because you've got the patients already to market.
Absolutely. And how often, one question, we said about the 6 months, how often do you have to have treatment?
The first 3 treatments are done 1 week apart.
Okay.
And then after that, they're every other week. And when we do every other week, we're doing pretty good. I mean, everything's working great. And like I said, we want you to keep coming for 6 months, let's get this fixed.
Well, Jeff, really appreciate you joining us on the podcast. Is there anything else that you want to add that we haven't covered?
RegenMax.com.
What's the website?
RegenMax.com. Please, I'm very passionate about this, and there's a lot of men. Listen, I had to go into many years of counseling to get my head cleared because it affected me emotionally that bad when I'm 40 years old and I can't have sex. It was a major problem. And there's a lot of guys. Do you know ED is the number 3 cause of suicide in men? Yeah, it's not something to play with. Literally, it's not. So by all means, let's talk. Help me get this into the UK. Let's blow this up and get people fixed and back at it.
Absolutely. Well, guys, reach out to Jeff if you're in the US, to RegenMax. I'll put all the contact details in the show notes. If there's any doctors listening in the UK as well, and you want to speak to Jeff about getting the services over here in the UK, then by all means reach out as well. But Jeff, really do appreciate you taking the time to share this, and hopefully it's got some people thinking that there is an answer. They're not like literally the unfixable person. There's an answer for them.
Ollie, thank you so much for having me. There's hope.
There's hope.
We can fix it. Thank you for having me on.